Hello, everybody, and welcome to another one of our Zoom webinars about technology and children. It's this, hold on, it's transcribed, it's recorded, good. So welcome to another one of the webinar series that we have talking about technology and smartphones and screens, and of course, children. And we've had many webinars so far with psychologists and coaches and technology experts and legislator issues and other stuff as well. So today, our focus will be what do the physicians or the healthcare providers have to say? And we're really lucky because you're going to hear, I'm not going to do the introductions now, but we have here a very experienced physician assistant who has been doing this for decades, and especially in terms of the mental health. We have a psychiatrist who's the vice chair of a psychiatry big hospital, but also doing a lot of other stuff. And we also have a pediatrician who is, I've heard about her from multiple people, including physicians, who has also a blog that became kind of famous about parenting and children and stuff. So that's what will be our focus today. And I just wanted to say a few things before we start. I'm going to introduce Kelly, who's going to be the co-moderator for today. And when we talk about these things, it's really important that, and I'm saying this most of our webinars, is that this is more because we want to enhance and have this conversation. These are topics that we can't ignore. The issues of smartphones and social media and children. And, we just want to add more people to the discussion and engage, because it's not something that we can ignore. It's not about judging parents who choose to give their kids social media or smartphones. It's not about anti-technology. A lot of us are actually very much involved in technology. So it's really just to encourage people to talk about it. And we encourage all of you to continue joining us in future webinars and share this with a community of parents and, and anybody that educators, etc. So with that, my name is Yair. I forgot to introduce myself at the beginning. And I live here in Pennsylvania, in the area of Greater Philadelphia. And I'm very proud to introduce Kelly Marsh, Dr. Kelly Marsh. So Kelly is basically, in her background, she's a cancer researcher and a bioanalytical chemist, but recently she's been more and more advocate for mindful technology and use guided by data-driven parenting decisions. She's a mother of 3 herself. She's living also in Pennsylvania, outside of Pittsburgh. And I think it's important to mention that she is one of the co-founders of PA Unplugged, and she's going to tell you a little bit about PA Unplugged. It's an amazing organization that I recently joined, and they're doing a lot of different stuff, again, in terms of starting the discussion, talking about all these things, engaging people, parents, educators, and specifically what Kelly has been doing, which is unbelievable. She's been the lead person in legislation, and she'll tell you more about it. But there's now more and more states across the United States, obviously also other countries, that are basically more acknowledging this issue. And for example, bell-to-bell policy, that at least within school, there's not going to be any smartphones. And Kelly has been leading this efforts in Pennsylvania. And she's been spending, I don't know, Kelly, hundreds, thousands of hours of her free time volunteering to engage with dozens of legislators in the House, the Senate, and she's really doing an unbelievable job. So Kelly, take it from here, and please tell us a little bit about yourself and introduce our panelists. And thank you, everybody, panelists, and everybody who joined us today.
Well, great. Thank you so much, Yair, for that very kind and motivating introduction. And as Yair mentioned, we did launch Pennsylvania Unplugged recently. Just wanted to share a little bit about that. For those of you that are in Pennsylvania or elsewhere, please, join and recognize that there is a movement. There are other parents like me that are spending all of their free time, early mornings and very, very late nights, to really affect change. So Pennsylvania Unplugged is a coalition of parents across the state of Pennsylvania. It's comprised of a lot of local groups representing thousands of families. We now also have groups in 7 different counties in Pennsylvania, and we're really working together to create change for our kids and screens and how we approach technology, as Yair mentioned. Through our advocacy, which we focus on homes with parent education, schools, and local community changes and awareness, we recognized the importance of also working with legislators to enact common sense policies and establish those guardrails around technology uses for our children that are just going to be so important. To do this, all of our advocacy work, we're working with various stakeholders and connecting with experts to ensure that we're tackling this issue and bringing in the research and the data points that we have from all avenues. And this is going to be key, right? If we really are looking to achieve a cultural shift away from a device-based childhood. And so it's so important that we have these conversations. And tonight we are thrilled to be continuing that. This time, as Yair mentioned, with the medical providers to hear their perspectives from their work in their clinic. And this can help empower patients as well, parents, excuse me, as well as help inform policies as we work towards those changes. So with that, I just wanted to jump into introductions. So first, joining us, we have Rosanne Levine as a nurse practitioner with over 22 years of experience in pediatric primary care. She just recently retired a few months ago, but we are thrilled to hear from her as through her experience in primary care, she was designated as the behavioral health specialist in her practice, responsible for diagnosing and treating children and adolescents and young adults with anxiety, depression, ADHD, obsessive compulsive disorder, autism, spectrum, social skills deficits, and other behavioral issues. So all very relevant to our conversations today. She currently lives in Pittsburgh and is a mother of 4 grown offspring and a grandmother of 4. And because of this and her extensive clinical experience, she is an advocate in this space. And we're happy to have her as part of Pennsylvania Unplugged. So welcome, Rosanne. Next, we have Dr. Joannie Yeh. She's a primary care pediatrician and an associate professor of pediatrics with a special interest in mental health disorders. She is passionate about speaking and supporting kids and caregivers' mental health and emotional wellness. She manages and contributes to an active blog, betamama.com, which hopefully you'll see here in the chat soon, the link. This blog focuses on parenting topics and evidence-based inspirations for and topics including such as screen time and suicidal behavior. So please check that out and welcome, Joannie. Finally, we have Dr. Howie Levin. And he's a child psychiatrist whose clinical and academic work has significantly shaped the understanding of social media's impact on youth mental health. He's the president of Lehigh Valley Psychiatric Society, secretary of Regional Council of Child and Adolescent Psychiatry of Eastern PA and Southern New Jersey, and vice chair of psychiatry at St. Luke's. Dr. Levin has contributed to numerous initiatives addressing the intersection of digital media and adolescent well-being. His work spans clinical evaluations of social media behavioral risk, policy advocacy through the Child Psychiatry Regional Council, and thought leadership in the professional development forum, such as the Nazareth Area School District Professional Development. He is leading a lot of community engagement initiatives, which I do hope we can share a little bit about more, especially for Pennsylvania folks, some events that he is involved with. But his advocacy for balanced and developmentally informed approaches to digital media use continues to influence clinical protocols, parent education, and national conversations on youth mental health. So welcome. And to get started, I was hoping we could just start with each of you sharing a little bit more about and talking about your clinical experience and maybe mentioning any trends that you have observed with your patients over the last several years relating to online and device usage. And Rosanne, can we start with you?
Sure. Thank you for that lovely introduction, Kelly. And thank you, Yair and Kelly, for organizing this and moderating it. So as you mentioned, Kelly, I have been in pediatric primary care for about 23 years. And in the last 13 years, I was pulled into a practice to address behavioral health issues. I was told that I would be spending about 25% of my time with behavioral health patients who would be referred by the pediatricians in the practice. And it increased and increased to the point where it was over 50% of my time. I was the second person in this practice to be addressing these issues. We had to pull in a third person into the practice because the issues just kept increasing and increasing. And I realized when I started looking at the research that this wasn't my imagination. The issues really were increasing, and it wasn't just a measure of screening. If you look at the youth risk behavior surveillance that has been done since something like, let me see what year they started, 1991, and the same questions have been asked. More questions have been added, but you can see that these issues really have increased. And then I started reading some of the research about um, social media, media use, gaming, smartphone use, and I saw how correlated they were with the mental health issues. So that motivated me to try to do something about this. So when I retired and had time, I joined Pennsylvania Unplugged to try to advocate and try to educate parents and try to advocate legislatively for these issues. Um, I would say that there's nothing like clinical practice to inform you. I'm sure that Howard and Joni, you'll agree with me. But all the parents out there, there's nothing like being a parent to inform you too. You see how your kids are. So I can talk more about this, but I'll let the other people go about what drove them, and then we can return to some of the things I've seen.
Thank you. Joni?
Yeah, so I just wanted to share that in every aspect of my patients' visits, screen time pretty much comes up. I take care of a lot of kids with mental health struggles, and so that's always a topic that I ask them how they're using their screen time, how they're connecting. It can be a great tool for staying connected with their friends, but I even, gosh, the patients themselves just have so many great ideas, and they make really great connections. And one of my patients who was struggling with depression and had a crisis over the summer, even though they were staying connected with friends by the digital ways like FaceTiming or texting or gaming, they said that actually it was the lack of in-person interactions that they thought contributed to their downward spiral, which I thought was just such a brilliant insight. And so we made a plan to say, okay, like even in the summer, yeah, you're supposed to relax in the summer, but once a week, make a plan, even if it doesn't, to be with one of your friends in person, to get away from the screens. I have another patient who was maybe like 19, because I see patients until they're 21, who made the connection that when they stopped looking at Instagram, their mental health was much better, which of course a lot of the research shows. So it's just really amazing to kind of pick the brains of my patients to see their insights. And I do a lot of motivational interviewing style I guess, visits, conversations with my patients where they're kind of the captain and I'm just kind of their guide. Like they let me know where they want to go and we'll brainstorm ideas and really use their ideas, right? And when they have that idea, the plan is so much more successful. And so I think really asking our kids like, hey, well, I think that, too much, being on the phone too much or being on the screens too much is not good. We all know that. What are your ideas, right? Kind of pulling from them, making this a conversation, empowering them to make those choices. So then when they're independent from us, they can also make those choices as well.
Thank you. Thank you for sharing it. And then I guess last, Dr. Levin.
Yes, thanks for having me. So when I think about social media, I think about my first exposure, which I guess would probably be back about 20 years ago when Facebook came to college campuses. And that's around the time I was in college. And before that, there was like AOL Instant Messenger that people used in colleges to tell people where they were and what they were doing. And Facebook grew in popularity pretty quickly, but still, I mean, family, relatives didn't really have much exposure to it. And then it sort of opened up to the general public, and then everybody had exposure to it, but it still seemed like mostly adults using. And then I think as time went on, the age where people started using social media went down, to high schoolers, adolescents, elementary school kids. More apps came out. I think the social media companies over the past 20 years really refined their algorithms to really know what people want to look at and are interested in, to keep people looking at the social media apps. And so really there's been a lot done to almost make people addicted to social media through the increase in dopamine that it provides and the pleasure that people find in it. On top of that, definitely the pandemic in 2020, where adolescence being a time where social development is so important, and then cutting off all socialization during the pandemic, and then how to get kids to reintegrate socially after the pandemic. A lot of kids were anxious about returning to in-person schooling. Some stayed in virtual schooling, and most of their peer group, their friends were online friends. And while they would say that was good enough for them, there was this underlying sense of loneliness, depression, um, and it still seems like things haven't returned back to maybe pre-pandemic times in terms of adolescents, younger kids feeling like socialization can happen in person. Like there's a lot of social anxiety out there, definitely. I think kids don't know how to express themselves, don't know how to meet other people. I think young adults don't know how to express themselves or meet new people. And I think the impact of social media on that has definitely been a negative, increasing depression, anxiety, leading to a lot of social comparisons. And just in terms of everyday communications among families, people are spending all their time on their phones and not really talking to each other. Um, so I think there is a place for social media in society. It's just there needs to be some guardrails around it. Otherwise, it sort of led to a spiral of negativity, it seems.
It's interesting because both you, Joni, and Howard have addressed this. The Pew Research study showed that almost 50% of teenagers are online almost constantly. However, this is a reversible issue. And I found that when kids were removed from their devices, if the parents took the devices away, the behavior would be miserable for about a week. And then the behavior would improve dramatically. And you might think, well, maybe that's because the parents took it away as a punishment and therefore they're behaving better to get their devices back. But then you wouldn't have the miserable behavior for a week. I interpreted that as the miserable behavior was a withdrawal symptom. And then once they withdrew after a week, they improved. The other thing is that I had kids who were anxious and depressed, and then all of a sudden there would be something that would happen that would naturally take them away from their devices. Maybe band camp would start, or sports practices, or the school play, or whatever it was that got them involved, and they didn't have as much time to spend on the devices. Their objective depression screens would improve dramatically. So I really do believe that this is totally reversible, and we have the power in our hands to do something about this.
I think this is very interesting what you're all saying, and I have a question to Joni. But before the question, I just had to comment on what Rosanne just said. To me, it's pretty clear what you're describing. It is a withdrawal from some sort of, I think Howie mentioned maybe dopamine, maybe other transmitters, but there is an element of withdrawal. But to what you said, I just had a few days ago a conversation with my neighbor, and we were talking about cell phones. She sends her kid, who's about, I forget, 12 years old or something, to a camp in the summer, some sort of a nature place that there's no cell phones, there's no screens. And she came back, and when the school was about to start, after she started, she was like, the daughter herself, she realized, you know, I'm kind of gonna miss the fact that we don't have a phone, because she recognized that once she has the phone, the smartphone, this and that, she's gonna be sucked into it. And these couple of months or so that she was away from it, of course, there's also the element of having the best time in their life with friends and, you know, water and lakes and whatnot. But just the element of not being connected to the screen is something that she herself was able to recognize. My question to Joannie, you mentioned something that you always talk to parents when you're seeing them, or to the, you know, the parent and the child, about screen time. So I'm a physician and I'm interested in what you have to say. In my world, cardiology, adults, whenever people come, I talk to them about, you know, I ask them about the regular things that are important for prevention, you know, smoking, overweight, exercise, nutrition, things of that sort. So to me, it sounds very reasonable. But is it really something that most of the pediatricians, either general pediatricians or psychiatrists, speak about this frequently? I don't know. I mean, you may be something special. I don't know how long you have for your meeting, maybe 15 minutes, 20 minutes, and this can start a whole long conversation. And then the second thing that I have, and when I spoke to a lot of pediatricians and even invited them to join a webinar, many of them are kind of like, they know that they see it. They're not blind. There's no, yes, you have the research and you have the empiric, you know, the day-to-day life. They know it, but they are concerned about speaking in public because it might sound as, and I get it, it might sound as judgment of parents who maybe think differently than them. So do you think that the general community of pediatrics are moving towards basically open, frank conversation, including what you really think?
Yes. So let me answer that first question, or the second question first. So I'm also part of the American Academy of Pediatrics Council on Communications and Media. So I guess maybe in my world, everybody is talking about this. And at least, you know, the other pediatricians that I'm talking to. So it's a very common topic. And then of course, in the mental health world, we're constantly talking about screen time as well. So recently I know there's this like TikTok trend too. And so I kind of like use that phrase recently with my families, or sometimes with the patients. So I'm like, listen, I deeply care about you, whether it's to the parent, because sometimes I have something to say about their wellness, you know, that I notice that could help them, or to the patient themselves. I say, if I, there's this trend of like, if I didn't worry about hurting your feelings, like what would I say, And I think the problems that social media and technology come with, the heavy burden and responsibility and how it can go sideways quickly, is so serious and heavy, and affects our mental health in so many ways, which our general mental health is spiraling down already. I do feel that it's urgent to mention it, And I think with that, because I'm a primary care pediatrician, I've seen a lot of these families for years. They have also that trust that if I'm going to take the time to say something, it's because I really want them to hear it, and that I know that they know that it's coming from a place of like deep care, and that also we have this foundation of like not being judgmental, not judging them, like you had said initially, like this is a platform where we're not judging. And I had this one mom today, and it had more to do with eating, but she's like, doctor, I know you want me to offer the veggies, but it is such a struggle. And I said, you know what, and so this can go with screen time too. You know how far to push your child, and how far you can handle in pushing your child. And that's what I want. I want you to have that goal to, whether it's like eating healthier, offering more veggies, or decreasing screen time. And then I want you to trust yourself in how you do that. This is the basic gist. This is the basic goal. And it's like, we're all a work in progress. Like when I'm talking about like exercising more, I'm like, to my patients, I'm like, oh yeah, right. I could probably, like, instead of scrolling, see, it goes back to the social media. Instead of scrolling on Facebook, I could have done like a few push-ups, I could have used my weights a little bit. I didn't exercise today. And so like, there's always something that we can do to improve. And so, we're using those visits to talk about like, oh, is this, like what else could we tweak to optimize our health? And there's a conversation, so then I get feedback from the families about what works for them and what doesn't. And so ultimately it's their decisions, right? And honoring them, but helping them kind of like maybe reprioritize like that goal of decreasing the screen time. And then just one thing I wanted to mention too, with decreasing screen time, I always say, hey, let's like, what can we do to replace that, right? If we're only like sitting around and bored, sometimes we do have to help our kids, like redirect them, you know, like what activities are we signing them up for? How can we help them open up their social circle? And maybe it's that they have severe anxiety, and so that's why they're not signing up for anything, and then they're hiding behind the screen, and then the anxiety gets worse, right? So then they're not functional. Let's bridge that gap and problem solve that instead of letting them, you know, stay in their comfort zone and hide. But using, you know, other supports to help them, so they're not like so that they have skills and tools to do that.
Yeah, the other piece of that, I think, is that every pediatrician is going to ask, how are you sleeping? How many hours of sleep are you getting? Are you happy with how you're doing in school? Those are two key areas, because a lot of times kids would come in and the parents would say, my child isn't sleeping. My child is up all night. Yes, the child is up all night with a smartphone, you know, whatever they're doing on it. Or my child has had a sudden drop in grades, or my child is taking 4 hours to do homework that should only take 1 hour. Well, it turns out the child is having the smartphone there while doing the homework and is distracted every 2 seconds from some ping from an app, you know, distracting the attention away. And so I think that those are kind of like inroads to make when you're in a pediatric visit, to explore what exactly is going on with this child. Why are these occurring? And we also know that it's been proven that enough sleep is a positive factor in combating depression. And being involved in activities is a positive factor.
Yes, thank you.
I can comment on the question and answer. So the questions are pretty similar about one-to-one device.
Before because that's a topic that I hope we can spend a lot of time on, because I know that it comes up a lot. I just wanted to comment that I really appreciate, Dr. Yeh, you saying that we have to really frame this as parents as what is the devices replacing? Because there's only so many hours in the day. So if they are, you know, using these devices, what is it replacing? And, you know, are you okay with that? And is that, you know, a value that you have? And is that, you know, consistent with what we are learning in the research that's coming down on this, the increase in depression and anxiety that we're seeing, and the correlation to logging on the social media, or the addictive algorithms and the persuasive design that we see on a lot of this content. So I do appreciate you mentioning that. And I do think, at least, you know, when we talk about this and when we hear from parents, it's really framing that as making sure we're realizing that this is replacing something, and to make sure that we're offering, you know, could they be doing more physical activity? Could they be being bored, which we know the power of boredom and the importance of resting our brains. And I think that it's really important to put that into context, is all I wanted to say. And then, yes, I would love to dive in. We're getting lots of questions here, and we hear from parents all of the time across the state, and frankly, across the nation, when we're connecting with these national organizations, Smartphone Free Childhood, Fair Play, the Becca Schmiel Foundation, Distraction Free School Policy Project. Everyone is kind of, all these parents are kind of getting activated and looking because of the one-to-one devices that are so prevalent in our schools. And that's what these questions are about. So we just would love to hear your group's point of view on the rapid onset of technology in schools and the increase of gamified learning. And, you know, for example, how old should a child be before they get a one-to-one device? And how do you think schools are justifying these devices and handing them to kindergartners, and, you know, without really reaching out to medical professionals on this, and then parents, because these might be against their values that in their home. So I'd love to have you open that discussion up, and hear from each of you on that.
Well, so my kids are in elementary school and middle school, and I never, to be honest, there are so many opportunities in the home to decrease screen time that my brain is not even like in the realm of like the one-to-one devices. What I will tell you, again, this is kind of like what I've done. And I know that every family, you know, has different needs and different like kind of life structures and routines. I do not use, when it's in my control at home, I don't use like learning apps. I don't use, so that's a lie. The only learning app my kids use is Duolingo. And even then it's like a little bit almost every night. But like the middle one is middle child syndrome is a little hard to get her to, like, you know, be a little kinder sometimes and, you know, decrease some of the anger. And so sometimes I use that as a little bit of a reward for her. If she's kind of gone through the day kind of smooth and done what she needs to do, then, you know, she does get that. But for the most part, I don't. Like with my kindergartner, you know, I like will print out things or get like dollar store, you know, handwriting things. But again, not every family has a printer, not right. So I think is what I tell families, as long as we're being mindful, right? There's also seasons where maybe the family's sick and we're just using screens more. That's okay, but we're being mindful. And we're like, oh, you know, when we get into that season of wellness again, we're gonna like rein that back. And so I think as far as the school goes, my kids are in public school. I, you know, trust that the teachers. So to be honest, I never really thought about it. Because it hasn't been an issue. Now, when they come home and they're on the screens, I'm like, do you really need to do that IXL program? Like, you know, because now it's like, oh, you're just kind of playing a game on it, you know? So I'm still paying attention to what they're doing. And then those moments, I'm like, I don't think that was an actual assignment. But then if they're actually doing homework, I mean, you know, I can't control everything. So they're going to have to take some ownership of that too, that they're getting their homework done, and, you know, that'll reflect on the grades. I think that technology is here to stay. So I also think that's important that they're learning and keeping up with the rest of the world as far as how they're using technology. And I think the teachers can do a lot more when they get that instant feedback for the students too, as far as where their levels are and getting that personalized learning from their tools. So I kind of let the teachers do what teachers do and then talk about what's like at home.
I personally, I believe that children learn from relationships, and I am concerned that too much device time in school detracts from the relationships. So I think that it's better in small doses. And I have written a lot of letters for 504 plans, which are, you know, when a child has a diagnosis, a child can get a 504 plan. I've written a lot of letters when parents have asked that their child be exempt from device-based learning. So I know that this is something that people want. And I also think that when devices are used for, quote, indoor recess, I'm concerned that that's taking away from playtime and from relationship building among the kids. So I do have a lot of concern about it. And I'm curious, Joanie, do your kids like the gamified aspect of Duolingo? Like, do they care how much XP they get or how long their streak is and all of that?
Yes, they did. And I when I saw that it was starting to be an addiction and they were carrying too much, and like if they go to camp, they're like asking the other sibling to do their Duolingo for them so they don't lose their streak. I'm like, no. We do not need, this is not a life or death situation. And so just kind of paying attention to those little clues in our kids. But absolutely, a good thing, too much of it can, become not great. And I agree with you that that the relationships are also very important. And that's where, I think is the educational kind of system. And I think that's so great that you're kind of advocating for that too. I know one of the best teachers my kids has ever had during indoor recess or indoor time, they would do, there's a lot of board games that they would play, like, different groups would play different board games. And so I don't think there was a lot of screen-based activities that they were encouraged to do in that classroom. But, of course, that can be very teacher dependent too. So I think advocating for that too is still very important.
Yeah, I think my kids are one of my son is now in 1st grade and my daughter is in 5th grade. So she just started intermediate school. My son was given an iPad in school starting in kindergarten, but they haven't brought it home yet. So it's been kept at school in kindergarten and 1st grade. I think it starts getting brought home in 2nd grade. I think that was actually a little bit later than my daughter. I think my daughter was bringing home her iPad in 1st grade, but at some point it does transition over to a laptop, I think in middle school years. I think there is importance in learning how to use technology. I think schools have a lot of safeguards in terms of restricting access to a lot of sites and a lot of things that would be inappropriate. So most of the problems I've seen with kids and technology in school have been the kids that are sort of trying to subvert the system, go onto inappropriate websites, and then getting in trouble from the school for being on places they shouldn't be. And then that leading to interventions like that kid not being able to use technology in the classroom, which also I think can be a little bit socially stigmatizing. So I'm not sure the right answer to that question. I think definitely technology has a role in education, and I like the schools that are implementing the no cell phones in school policy. I think that's great. But I think there's a lot of great educational apps out there that are probably helpful in learning.
Mhm. And I thank you for sharing that. I put in the chat here for those interested in learning a little bit more about the one-to-one devices and maybe, activating and advocating in your schools to maybe shift some of that. Please check out the Distraction-Free School Policy Project because as all the questions have mentioned here tonight and things that we've discussed, I think what's being a little bit clear and more is that we know the research that says that the importance of tactile when they're writing and taking notes and kind of that spatial learning as far as retention and cognitive experiences are much more important than they get on screen. Like we know that there's better retention on pen and paper than there is with screens. Yet, the adoption and the rapid onset of these devices kind of came into our schools, maybe without all of these safeguards being put in place. And I will just mention that, COVID, we talked about this earlier, COVID really kind of pushed the timeline on a lot of this and really forced the hand, I think, before we were really ready as a society. So I do say that, if you look at it, a lot of the schools don't have the accurate safeguards in place. That's something that the EdTech Law Center is actually looking into. And so again, if anyone's interested in that, please check out those things. But Pennsylvania Unplugged, we are starting those conversations and really trying to make sure that the gamification is not there on those apps and that we're really using the technology as a tool and not a consumer, and that the kids are exposed to those really high quality apps in a limited setting, not in indoor recess, not when it's replacing those social emotional connections that are so valuable. But anyways, thank you for sharing that. I do, someone had a question here, just would love more insight. If you guys have any from your clinical experience, and how you think about one-way social media versus two-way, like, so one-way being YouTube versus two-way like Instagram or Snapchat.
So I think a lot of like two-way technology that could, so I always say it's important to create and not just consume. But for kids, like I mean, even for me, I'm still finding myself scrolling, like, what am I doing? Like, I just like, just scroll, and I'm already mindful about this, I just scroll on Facebook for like an hour,
Yeah. Mm-hmm.
And while my intention was to go post something, and I was like, oh, right. Or I was going to go look up something. And then I didn't do that. And so I think as much as control I'm trying to exert, and I'm an adult with more of that prefrontal cortex, I think kids are so much more at risk for consuming and not having the maybe the recognition of like, oh, like, let me shift this, because very easily so I talked, during well visits, and yes, there's never enough time. So if your doctor runs behind, please be kind, because we are having these conversations and trying to answer parents, questions with never enough time. And, and so I do ask, like, okay, are we like talking about what's safe to watch? Because even if you have controls on your kids' devices, things still slip through. Like YouTube Kids is not always safe, so like what do you do if something pops up that you think is like not appropriate? Like, don't just keep going. Like, tell an adult, immediately break the scroll, tell the adult. And so even if it's two ways, it's also very possible to just get stuck in that consuming. I don't think it's the two-way stuff is any better.
I think that this is very confounded because kids are using both. The research, there hasn't been research on teasing one out from the other as to what's better or worse. So, because so many kids are using both, and the statistics are pretty staggering that almost constantly 30% of kids are on one of either YouTube, TikTok, Instagram, Snapchat. And a lot of them are on multiple apps. So when you add it all up, almost constantly online, including gaming, it's almost 50%. So it's very hard to tease out. I would say that the infinite scrolling feature that YouTube and TikTok have really, they try to get the kids to stay on as long as possible, because then they see more advertising. And that's the whole purpose of the tech companies. So that's a problem. The other thing is that it used to be that kids, when you were a kid, maybe kids were smoking in the bathroom, and now they might be vaping in the bathroom. But kids tell me that kids are also filming everybody who comes into the bathroom, or making TikTok videos in the bathroom. So I do think that kids are doing things in school that they're not supposed to be doing in school.
Yeah, I haven't seen any research on the one-way versus two-way either. My intuitive sense was that two-way social media use would be more dangerous, but then I was just reading this past week, there was 2 adolescents in the Lehigh Valley that passed away doing a TikTok challenge where they were riding on the back of a car and ended up falling off and I guess cracking their head open. So, and then I remember the TikTok challenge where people were swallowing laundry detergent pods, and all that was sort of just one-way social media use. But the two-way use, I guess I think a lot of the safeguards in terms of when your kid leaves the house and you ask them who they're going out with and what time are they coming home, and maybe being afraid of who they're going to spend their time with, there's just a lack of safeguards with who you're communicating with online and what that can lead to. So you feel like your kids are safe because they're in your house, in their room, but you have no idea what they're doing in their room and who they're communicating with and what information they're sharing. And that lack of impulse control, and just sort of feeding off of what your emotions are in the minute can definitely lead to problems in terms of sharing a lot more than you were intending, maybe in your rational mind.
Yes, I think whether it's one way or two way, so going back to that originally Q&A, for the going on YouTube and being addicted, I think that, and it kind of leads to the second question too about like how long to spend on the screens too, is that, you know, we can break it up too, right? And we as parents like do still have some control. We have control over the Wi-Fi, you know, password and paying the phone bill and things like that. And so I think that, you know, maybe start off with like, all right, well, we're going to have a timer. I know some families, when their kids are playing video games, they don't let them use headphones, especially when they're younger, so they can hear everything that the other kids are saying, and they can hear like, hey, this is a voice that I recognize, or this is a strange voice. Like, why are you playing with an adult? You know, and co-viewing too, kind of like, okay, well, you're interested in this video, like, well, let's watch it together. And so kind of doing that, but then also setting a timer for it. And so my kids watched a movie yesterday, and I said, all right, well, set a timer for, I don't know if they actually did this, but the chore got done. So I was like, well, set a timer after each 25 minutes of the movie you're watching. I gave them something to do, like to clean up like one of the rooms. You know, and so it was like kind of breaking it up, but then they got to go back to it. And I also tell my patients, especially if they have vision concerns, to look outside after they're on their devices for like maybe 20 minutes, you know, after each. So I kind of say after each like assignment, like look out the window. You know, most of your classrooms have windows, or go count how many trees you can see far away. You know, I give them kind of something to do. And it's like a mindfulness thing too, right? Then they're using like their different senses and looking at colors, and kind of regrounding themselves. And that helps, you know, with our vision and that like eye fatigue and headaches too, if we're looking far away. So those are a couple strategies, you know, to break it up, look far away, get out into nature, and replace that activity.
It's always easier to get your kids off the screens if they have something else to do.
I think this is fascinating. I want to ask Howie a question, but before that, I had a comment. I mean, I have a lot of things to say after hearing you. I think that the important thing is all of this is relatively, like in an historical perspective, is relatively new. You know, there's a lot of things that we don't necessarily know about the screens. Is it good? Is it bad? What about technology? And I think it's important this is kind of what we want to have these webinars and these panelists and in person, because of the discussion. There's no truth necessarily about everything. Like, for example, the ed technology, which is how to learn from tablets or, you know, things of that sort. There's some people who think differently, including on this panel. Like I've experienced, I have 2 kids, and they're completely bilingual. I speak only Hebrew with them. I'm the only one who speaks Hebrew. And the way that I do it is mostly by talking, and reading books. But for a while, I did, you know, I had a tablet, and I did try several of the applications of the apps, including Duolingo and others. For me, I think that without a doubt, it helped them learn. But I didn't like what happened. And again, this is only personally me. This is why we're having these discussions. And this is why eventually every family does what is right for them. For me, I could see that it was something weird. Their ability, you know, not only Duolingo, there's another one that the kid has to, you know, play the soccer or whatever, and then you get prizes, all these things. And they got so much into it. And if I said, okay, it's time for dinner, there's like no way in freaking out. It's almost like and then when can I do it again? When can I do it again? So they did learn because it does work. But there was something about this interaction with the screen that bothered me. And eventually I recognized that maybe they won't learn how to read and write as effectively, but I didn't like how it was. And again, there's difference of opinions. So, but there is one thing that is pretty clear, and I think every provider that I've spoken with feels the same, which is smartphones and social media. So my question to Howie is this: what is the role, in your opinion, of, you know, you're pretty high up in psychiatry of children and adolescents, and what we see in terms of all the national momentum is we see people who don't necessarily have a background in, it's mostly just parents, as grassroots as it gets. Like the 4 founders of the PA Unplugged, Kristen, Kelly, Alex, and Kelly, then there basically are, none of them are with a background of healthcare providers, and they're just basically from the ground because they feel it and they want to do so much. But we don't see so much from the actual healthcare providers. You mentioned AAP or other psychiatric organization. What do you think is the role and responsibility if you, in the United States and Denmark and Scandinavia, wherever in Australia, you see this and you recognize, all of you, that this is very, very harmful for the development of the children, for the mental, anxiety and depression and all of this. What is the role and the responsibility of the physicians and the organizations to basically kind of take the lead on all of this?
Yeah, I agree with that thought. Definitely professional organizations, I think, could be doing more to promote appropriate social media use, the dangers of smartphones and social media. I think the challenge is, and Rosanne was mentioning this earlier, is just lack of research. I think everybody intuitively knows it's bad, but nobody's putting the funding in to study it on large scale bases. That can then influence policy. And I think there's always a funding problem when it comes to research in terms of who's going to fund these large multi-center studies. What would such a study look at? Would you have half the study sample, and maybe people would be willing to sign up for this that wouldn't have any smartphone use in their households for 10 years versus kids that do use. So a lot of it's based on sort of just naturalistic, what is going on in the world and making correlations, and the causation has been challenging because there hasn't been really good, well-designed studies to look at it. And so I think people in medical professional societies are always hesitant to make policy statements without feeling like they know where the evidence is. But I do think there's much more research that's needed to be done. I think that grassroots efforts by parent groups is great to push legislators, push professional societies to do more to study it. And so I do like the energy.
We're trying. We're trying. I know, it's hard because I'm a scientist, so of course, I love data. I always want more data, always. But I think too, it's, there is research coming down. There's JAMA articles almost monthly now correlating social media use with white brain matter changes we're seeing, and especially in young children. I'm not a physician, I'm not a mental health expert, but that's, raising flags to me, and sort of, I feel like I'm not feeling sort of the reaction and the, from that we would expect from the medical providers. But especially when we look internationally and we see, guidelines from the Spanish Academy of Pediatrics that have said, absolutely no screens before the age of 6, and then no more than an hour between 7 and 13. French medical experts are coming out with similar guidelines. So there are other countries kind of coming down. Australia now, I think, does not allow any social media use for minors. So we are seeing this in other countries, and I guess, living here in the US, we're just looking to see, again, like you mentioned, we're trying to push legislators on this, trying to inspire additional research studies on this to really move that needle. But just the urgency is here. I think we don't want to wait, 10, 15 more years.
Yeah.
Another
and I have to say too, I am proud to be a member of the National Association of Pediatric Nurse Practitioners, and we are getting ahead of this issue. And so I think the AAP, the APA, these other organizations should look at what we're doing.
Yeah, so I
also think U.S. medicine in general and the healthcare system isn't focused enough on preventative care, and is very focused on treating disease states once you have major depressive disorder, once you have a clinically diagnosed anxiety disorder, then we'll look at medications that help with it or therapeutic modalities that help. But people in the United States, the medical system really isn't set up very well to focus on nutrition, exercise, social media use. I think it's a shame that preventative medicine has sort of fallen by the wayside a lot in U.S. healthcare.
So I wanted to comment on the school use. Someone had asked, like, how can parent advocates like educate the medical professionals? So I think, you know, these stories that you guys are sharing is very helpful. And I think it may, you know, I'm sure it kind of depends on the school district as well. So of all the kind of like Dr. Howard is saying too, like of all the problems I've seen, I haven't had any patients, you know, or parents say any like mental health problems or, you know, other issues were triggered by, I guess, technology, like some sort of technology that was happening at school. Like when I had a patient who said something about, like, I think a gun or something, you know, and he had seen a TikTok on that, right? So it was on his personal device on social media, and then that led to, you know, like a school like punishment and coming to see me and, you know, talking about his mental health and, you know, things like that. And just, you know, more conversations about responsible social media use and, you know, how to like make sure you're surrounding yourself with also like peers that are, you know, positive influences, you know, things like that. And he's, you know, he's done very well with those conversations. He's like very smart. And so I guess it hasn't been, you know, like in a spotlight for me because there's just so many opportunities where in the home, right, that like, and a lot of the problems are from like kind of personal use. So I definitely am going to, so I really appreciate you guys bringing that up, and I'm going to look into more like the studies on how does technology in the classroom affect the students. And I think it's a balance, right? It's like, okay, well, we're going to have some time, you know, it has to be a balance. Like, you know, we're going to have some time on the screen, but then we're going to like have an in-person discussion, right? And in a kindergarten, we're not going to be in front of screen all day. We're going to be like singing, and I think most kindergartners are still like on the carpet, you know, for like circle time. But then I'm like, oh, like, are they? I know mine is, but like, right? Like, I think as parents, like, I guess we just have to make sure that that's happening in our schools. But I also, I guess, just have so much respect for teachers and like the education and how much that they have to like, you know, all the different 504 plans and IEPs that they're trying to like balance and evaluations of their students. And, you know, I have so much respect for them. And, you know, but I think also as advocates, then, you know, let's also like, it takes a village, right? Let's all kind of keep an eye on that.
Yeah. And it's a good point. I think that, what we hear from parents is that, there is so much unknown about the screen usage in schools, and there's not a lot of transparency. So, if we're trying to balance, as you said, and say, okay, I need to make decisions about how much my kids can use screen in my home, it's almost like we need to know what's going on in the schools so that we can make those decisions at home. But when that's not transparent or not known and shared, it makes it difficult, and then folks get frustrated with that. And Laura Derringer from Vermont wanted to share that Spanish Academy of Pediatric Guidelines does include screen school usage. So it's all screen time in totality. And so again, just clarifying that, it is hard when you're looking at the whole child, which all of us are, parents, these amazing teachers, these building administrators, the education policy, the departments of education. We're looking at the whole child, their education taken together. And it's, we do all need to kind of work together and make sure that we are making the best decisions that are right for our kids in the academic setting and the educational setting, as well as the social, emotional. The other thing I will say is I just wanted to mention that it's important that we distinguish tech ed and ed tech. So technology education, which is explaining and making sure that our children and the next generation know how to use these devices, what these tools are, what they can create, how to navigate those. But that might be a little bit different than sort of some of the ed tech applications. It's referred to as ed tech. This whole industry that's selling these educational apps to our kids. So I wanted to say that. If there are no more questions, so one of the things that you brought up, Dr. Yeh, and I wanted to follow up, you mentioned that it's so hard in the appointment with your one-on-one because there's not a lot of time. And one of the questions was, and I would love your feedback on, and from the other panelists as well, is how can parent advocates appropriately share our learnings or our concerns? What venues can we, either one-on-one with our pediatrician or at an association level, where are forums for these conversations that we can get experts to, and we can have these, continue to have these types of conversations?
Well, I always tell parents that if there is something that you see that you think is very useful or helpful, or you're like, well, Dr. Yeh, you said this, and I read an article about that, um, I always encourage them to share it on the portal with me, share the link, and I say there's so much out there that like sometimes I'm Googling, myself to see what more I can do, for my patient.
Mm-hmm.
I'm always willing to learn more. And so I welcome them to send a link to an article or something like that. So I think that's something to, that you can do. I'm also gonna, so the AAP has a digital family media plan. So if you just Google like AP and digital, what is it called? Family media plan. It has a lot of resources about how to like create screen-free times, for the family in places like meal times and, like basic stuff. I think everyone here is probably a little bit beyond that because, you're obviously here and very interested and aware, but it kind of like meets, I think there's resources there, like free courses and, and things like that to kind of meet parents where they are. And I think that's also why, like, before it was a hard, like, oh, like under 2, like no screen time and like less than 2 hours of like TV a day. But then it's like kind of a little tone deaf for families that are like way beyond that. And, so then they're not even listening. So I think it's just like if you meet one family and you see how they're using screens, you've met one family who's like using screens, right? And it has to be kind of like customized. But at the same time, I think we can also come from the angle like, all right, well, what am I going to say without hurting your feelings? Like, you really got to get your toddler off the screens. I know Miss Rachel's great, but like, let's just sing some songs to them in person. I do tell my families, like, don't buy VTech stuff, just buy building blocks and let the kids be bored. Let them whine. They are so much more creative when in boredom. So, kind of like sharing the benefits of boredom, and that it's okay to let your kids be bored and like, be a little uncomfortable and deal with, right? That's kind of like that emotional regulation when they can sit with their discomfort and know how to like get through it, like then they're set for life. But if they're always using the screen for emotional regulation, then, then they won't learn that skill and then they'll have problems, later on or rely on other things.
Joannie, if I can comment on what you said, because I think that it's very relevant and also related to a comment or a question that we have. I think that the boredom is something, and we just had an in-person meeting with a psychiatrist to talk about boredom. And it's not really, some people think that, okay, boredom is something that your child their brain is going lazy in a way. But in fact, when they're bored it's unfortunate that it has some sort of a negative connotation. But when kids are just, outside playing or inside just chilling and they're okay with it, their brain is actually working in a different way. And there's generation of so many, imaginatory forces. And it's really, really important for their development. And in fact, the reason that I'm saying that it's important is one of the questions that we just got, I saw the name, I was like, I know this name. And that's Holly from New Jersey. And hi, Holly, I'd love to touch base with you another time. But the reason that what I saw is there was a big Time article in the Time Journal about Holly and her group that she basically formed in New Jersey. And why is this related? It started about before they talked about the cell phone and what it does to children. She basically started she lives in the suburbs of New Jersey, and she just wanted her kids, instead of doing the regular stuff, being at home, being driven to the school, just go on your bicycle and go to school on your bicycle. And she did it at first alone. People were like, this is weird. But then more and more parents, and now their whole communities. People are just outside walking, communicating, biking together. And, you know, I recommend, I'll share the link, but it was a wonderful link. So to that point of Holly and what she's doing in terms of just like be kids, be outside, then, you know, her question, Holly's question is, what can, you know, she or every parent advocates who feel like us, what can they do to share our deep learning and what we have experienced with medical professionals such as yourself, Howie and Rosanne and Joanie, that we can, you know, counsel patients with this accordingly. We want to communicate with you kind of, you know, both ways. We want to share with you our experiences as well. So that's a question.
Another aspect of it is, parents, you can be the leader of your waiting room. When you bring crayons and books and think of some guessing games to do with your child in the waiting room, you can be a role model for some other parents who might be tempted to just stick a phone in the face of their 2-year-old. And so if you do that, other parents may just join in and copy you.
I think you bring up a great point, Rosanne, and again, why we are so empowered to have this be a collective action piece. We've talked a little bit about schools and home, how to balance that, but you need transparency with the teachers. We've talked a lot about, you know, you had just mentioned like it is really hard, and we hear from parents all the time, even go to a pediatrician's waiting room. All the kids are glued to their screens in the waiting room, and we know that's not necessarily best practice. But you know, that's what our kids see, and that's all they know. So, and I appreciate what you're saying is like, you know, we should be empowered as parents if we don't feel that's best to like have them read a book or play with blocks or bring a toy. But it really is hard unless we all kind of hold hands and do this together. And you see this cultural shift. It is hard standing here alone, what feels like alone. And so that's why, you know, with the Pennsylvania Unplugged, we're just we're, you know, invigorated to identify and find our people, other people that are sharing these concerns, medical professionals, legislators, and mental health experts that are all kind of engaged in this and talking about it. So again, thank you guys for that. Maybe in the last couple of minutes, you know, Dr. Levin, you talked about this, so I would like to follow up. You know, our U.S. healthcare system is very lacking on the preventative care and much more on the reactive, sort of when it manifests into a condition or a disease or someplace that we need to intervene. With this webinar, what could each of you share something that you would, based off of your clinical experience and your expertise, if you could speak to parents of young children? So these are not adolescents, teens, but parents of young children. What are some tips or some advice that you, clinically relevant advice that you would give to them?
Young kids, you know, I think one of the things you guys talked about with the boredom thing, I think is important in the sense that attention spans, concentration, hyperactivity, definitely there's been increasing rates of ADHD in our society. Why is that? Nobody's clear on why ADHD. I mean, everybody has theories about it. Definitely, I think technology, the overuse of things that are very stimulating, they sort of hold your attention with very little effort, makes it challenging for anything that seems less stimulating, less exciting to really hold interest. And so when we see kindergartners, first graders without really much of an attention span, with a lot of hyperactivity, you know, are they living a very sedentary lifestyle? Are they not playing sports? Are they not going outside? Is a lot of the time spent in front of a TV or in front of a screen? And how do we break that cycle? I think really engaging the outdoor activities, engaging involvement in social and community activities and events. I think a focus on youth groups, maybe a revival religion in some places. I think all those things could be good things that can hold kids' attention that doesn't involve screen times. Otherwise, the teachers are seeing very hyperactive kids who can't focus, can't pay attention for longer than 5 minutes, and it's just because that's what they've been growing up with their whole life.
Thank you.
Parenting is challenging, but you can do it. You really can. And all these little fun games, you know, everything to a very young child is like an exciting field trip. Going to the grocery store, going to the post office, and talking to them. These are the oranges, and these are the bananas, and look how the mail goes in here. Pushing the elevator button. Look at the birds, look at the trees. All of that is stimulation for your child that is much more educational than any screen, because that engages you in a relationship with your child. Reading with your child, that is just so important. The child will love to read because the child will learn to associate that close feeling of being on your lap and reading, and having just a nice calm voice with the child as you read, singing to your child, playing games. Babies love repetitive games. You know, even if you just say, you know, ba 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 over and over, the babies will love that. So there are all kinds of ways to do it. And you know, talk to your own extended family too. They're your resource. Make connections in your community. So all of those things are really important. I would say, to parents with young children, delay the screen time. Keep it away, delay it as long as you can.
Thank you.
So I think for the question about how can parents share their information, yeah, I think if you write an article or like in a forum like this, I think that's great. And then I just looked at the AP because I know we talk when I'm in these meetings, like we talk about the feedback that we get from parents. So people do read those feedback forms, and if you go to, it's probably on every single website page on the ap.org, but there is a feedback form on the right side of the screen. And so fill out that feedback form and say, hey, you know, I just want to make sure, you know, pediatricians are advocating for this. And we look at those things. We love getting family feedback. Like, this is the reason why we're doing this. You know, there's something better that we can do, right? Like the reason why we stopped with the hard, like no screen time before this age, or, you know, and it kind of became a more unique, like customized plan was because of feedback, right? Like we wanted to make sure it fit with where the families were. So that's one avenue. I'm definitely going to share with the Council on Media and Communication about, hey, can we look and can we collaborate with the teachers and look into, you know, have a policy statement or something like that on technology use and screen. Like, can we, you know, like maybe share like, all right, well, it should be, you know, like 20 minutes spurts with like this much activity and this much, you know, social interaction has to be in there. So I've learned a lot from the feedback and the questions from here that I can take back to the group as well. So thank you for that. Oh, and I did want to say, I don't know if you guys know, like I am a huge like journaling junkie, and there's this like question a day. I wanted to, like, in my office, you know, I wanted to write like a question a day, like on the exam room, because yeah, sometimes the families are waiting a little bit, and I was like, oh, like that's such a great way for them to have a conversation, you know. And so one of my kids gets to pick the question of the day for the whole family to ask. We don't do it every day, we're not perfect, you know, but and then there's a game on Amazon I can't remember, but it's also some sort of like interaction game, and I wanted to have that. It's like, oh, I think it's like it's a prompt if you like had to go to a city, you know, and you had like, you know, and it was raining, I don't know, where would you go, right? Kind of like a prompt to encourage interaction. And so, you know, I thought about it in my head, and I feel like this conversation makes me think like, you know what, I don't care what anybody else thinks, I'm gonna do it. I'm just gonna, you know, I work for a big company, and so it's like I can't always like, I'm like limited in some things I can do, but you know, until someone tells me to take it down, I gonna do whatever I can to encourage that in-person interactions in the office. Yeah, let's go for it.
This has been an amazing conversation. I'm going to pass in a second to Kelly for final comments because we're almost out of time. But I did want to mention something about the research because you, Howie, and others mentioned about the importance of research. And just that you know, I posted previously on the chat here for those interested, 2 big research studies that just came out. And I think that they're both fascinating. There's all over the media and the Time, Economist, etc. One of them is basically from Europe, and we're going to host in a few weeks the 2 authors from Denmark and from Northern Ireland, those who are authored this study, and what they're looking at as smartphones that show clear correlation and causation to heart disease, risk factors, diabetes, obesity, hyperlipidemia, cholesterol for children, early onset diabetes, etc. And then the second study that is really interesting and related to schools, it's a huge study with over 17,000 people that the main author is actually now a professor at Wharton at Penn. And it basically showed that at school, if you take away the smartphone for the school time, the academic achievements and the mental well-being of the children is better. It is a huge study, and we're going to host Professor Alp Sangu as well in the beginning of November. So with that, thank you. Really, this was a fascinating conversation. I'm sure we could have continued for forever, but out of respect, we're going to stop here. So Kelly, last words.
No, I thank you everyone for joining and for our panelists. We appreciate all that you guys do. You're on the front lines, keeping our kids safe and healthy, and including their mental health and behavioral tendencies here. And we appreciate all the feedback. I love a lot of the stuff that I heard. The takeaway I hear as a parent is that a lot of the solutions are not expensive. It's mostly just me sitting and reading with my kids or taking them to the grocery store. It's not about buying new things. It's really about getting back to kind of those fundamental interactions with kids, which it sounds like is what they need from a young age. And then as they grow older, I heard here today that, just be really cognizant, establish very, very strict guardrails in the house. We talked about time limits. We talked about making sure they go outside. We talked about being mindful, not allowing it in their rooms, having these best practices in our homes to ensure that our kids are safe as possible. If it is that you choose to go on social media and allow them access to social media, although some of the things that I've heard today, I don't know that I would allow that. I want to delay a little bit later than I originally thought. So, but thank you everyone, and please, again, I'm going to plug PA Unplugged here, but please check out PA Unplugged for those of you that are looking for more collective action, and especially on the legislation side of things. So, thanks everyone.
Thank you everybody for joining us.
Thank you.
Thank you.
Thank you for all the attendees who joined us as well. The recording will be available. Forgot to mention. Bye, everybody.
Bye.